Okay guys, today what I'm going to do is I'm going to explain to you some of the common disease states of the GI tract. I'm going to begin with GERD. GERD by definition stands for gastroesophageal reflux disease. Basically what's happening here is the contents of the stomach, which are normally supposed to stay in the stomach, will regurgitate or reflux back into the esophagus. So just a couple of anatomical points here. Number one, the esophagus connects to the stomach, and each distinct section of the GI tract has a circular band of muscle that separates it from one another. So in this case, the esophagus is separated from the top of the stomach, the fundus of the stomach, by the lower esophageal sphincter muscle. Now, if you look in this little picture here, you got this dome-shaped band of muscle. That's a diaphragm, and the lower esophageal sphincter is right below the diaphragm. So when you eat a big piece of food, I don't know, like maybe a Hot Pocket, and you chew it and you swallow a big hunk of it, it's going to stretch that esophagus. And when that esophagus gets stretched down here, it's going to cause that lower esophageal sphincter muscle to relax, and that Hot Pocket goes into your stomach to get digested. Now, if it's big enough, you do it fast enough, it will actually irritate the diaphragm, and that will cause the diaphragm to contract, spasm, and you get hiccups. So that's how it works. Now, the other condition that can exist is, in some people, the top part of the stomach actually ruptures through that hole. So if you have a hole in your schedule, your work schedule, you are considered to be on hiatus. So a hiatal hernia refers to the fact that this little hole, this hiatus, the esophageal hiatus, actually gets bigger, and the top part of the stomach actually ruptures through the diaphragm into the thoracic cavity. So if you have a part of your body that is not in the right cavity, that means that part of the body has herniated. So you have what's referred to as a hiatal hernia. So let's quickly review. In the video that I showed you on the digestive process, I explained to you the cells that primarily make up the stomach. So let's just review that real quick, right? So there are basically three cell types in your stomach. You have goblet cells, and those goblet cells secrete mucus. And that mucus is protective. That mucus that's released from goblet cells will coat the inside of the stomach. Because the stomach is made of muscle, and muscle is made of protein, and protein is digested in the stomach, your hydrochloric acid and pepsin that is released from the other cells doesn't know that that is your stomach and you need it. All it sees is protein, and it will begin to digest it. So embedded in that mucus is bicarbonate, and as we learned, bicarbonate's a base. So that protective mucus lining is what prevents the digestive enzymes and the hydrochloric acid from digesting your stomach. Well, sometimes things don't work out right, and the hydrochloric acid and pepsin will actually begin to digest your stomach, and you will erode that, and you will get what's called a peptic or gastric ulcer. And if it is bad enough, where enough of the destruction of the stomach lining has occurred, you will get a bleeding ulcer, and that's bad. What's really bad is if it is bad enough where the hydrochloric acid and digestive enzymes erode, break through digest the entire thickness of the stomach wall and the stomach contents to go up into your abdominal cavity, you have now what's called a perforated ulcer, and that's devastating. That gooey bad stuff that's in your stomach, remember, anything that is secreted into the GI tract is considered outside your body, right? So now you got this gooey hydrochloric acid and pepsin in your abdominal cavity, and that can lead to peritonitis, sepsis, and death. Bad for you. So, anyways, we talked about the goblet cells, and then we also talked about the fact that you have parietal cells that secrete hydrochloric acid, right? So in the video on digestion, I explained to you how parietal cells actually produce the hydrochloric acid. So just as a quick reminder, if we take this right here, this little picture right here, we make it a cell of your GI tract, a parietal cell. Then very quickly you have the blood, then you have the parietal cell, and then you have the lumen of the stomach, or the inside of the stomach, right? So embedded in the luminal side of the stomach, you have these pumps, and you also have these little channels called chloride channels. So very quickly, CO2 from the blood is going to come in. It's going to diffuse into a parietal cell. CO2 is going to combine with water. Oh, the equation you love to hate. Form carbonic acid. Carbonic acid will then dissociate into bicarbonate ions and hydrogen ions. It is the job then of that proton pump to pump them into the lumen of the stomach. Bicarbonate will diffuse into the blood, and because it's negatively charged, a negatively charged ion from the blood has to come into the parietal cell. It comes into the parietal cell, says vocabulary to the maternal for a moment, and then leaves through a chloride channel in the luminal side of that parietal cell. So now what you have formed is hydrochloric acid in the stomach. And what pumps those hydrogen ions, and a hydrogen ion is the same thing as a proton, are these proton pumps. Now, if you also learned, there are little receptors on parietal cells. Again, here we go. And they will recept chemicals. And the chemicals that they can recept that will increase the production of hydrochloric acid are histamines, epinephrine, adrenaline, and gastrin. These all increase the production of hydrochloric acid in the stomach. And that's important when we understand how some of the medications that are used to reduce stomach acidity. So having said that, let's go back to our stomach. Now look, one of the things that will begin the process of forming mucus from the goblet cells is food in your stomach, right? So the process of beginning to eat, parasympathetic stimulation is going to stimulate goblet cells, and you're going to produce that protective mucus lining. Then gastrin is going to stimulate parietal cells to begin the production of hydrochloric acid. And it's also going to stimulate the release of pepsinogen, and then it will be active to the active form of the enzyme pepsin, which will help digest protein. So the primary nutrient that's digested in the stomach is protein. Now, there are conditions that can cause the lower esophageal sphincter muscle to weaken. And if you look, most of the day we're upright, right? So when you eat by gravity, the contents of your food should be in the lower part of your stomach. Also, because of gravity, the mucus that's formed doesn't coat the fundus in the upper portion of the stomach very well. So, and you shouldn't have a lot of acid up there anyways because you're upright when you're eating. So people develop GERD or gastroesophageal reflux disease when they do things that they shouldn't do, like not study or not read the textbook, right? So what do? They eat late. And when you eat late, you go to bed. You should write that down. The other thing that they do is they smoke and they drink alcohol. All of these things are GI irritants and can increase the production of hydrochloric acid. So if we watch, you eat late, then you smoke and have some drinky drink, then you go night-night. And the hydrochloric acid and the protective mucus lining that is usually in the lower part, because that's where your stomach contents are, now when you lay down and go night-night, they will come to the fundus of the stomach where it is less protected. And over time, what can happen is, because what's digested in the stomach, protein, that lower esophageal sphincter muscle will become eroded, and the stomach contents will reflux into the esophagus. So what are people told to do? Don't eat late at night, stop smoking, stop drinking, stop swearing, and actually put some bricks underneath their bed to elevate the bed completely so that the head of the bed is slightly higher than your feet. Not so it's uncomfortable, but enough to keep the stomach contents down. So they develop a condition called GERD. And the most common symptoms of GERD are what are referred to as heartburn. So hydrochloric acid is caustic. The esophagus, because hydrochloric acid isn't supposed to be here, doesn't have that protective mucus lining. So that will reflux back into the esophagus, and that hydrochloric acid and digestive enzymes will begin to erode and damage your esophagus. So you will get symptoms of heartburn, pain, epigastric pain. You may get a little nausea, maybe even burp up some hydrochloric acid. So those are the classic signs and symptoms, and those symptoms typically get worse after you eat, or if you eat and lay down, or you combined smoking and drinking alcohol with eating, because all of those will stimulate the production of hydrochloric acid. So if you weaken that lower esophageal sphincter enough, then stomach contents are going to regurgitate back into the esophagus, and it will become eroded. You get a condition called erosive esophagitis. And if that condition gets bad enough, remember, when you damage cells, you can actually damage the DNA, and that can lead to a form of cancer called Barrett's esophagus. And what they'll have to do is they will have to remove the damaged esophagus or the cancerous esophagus, and what they'll actually do is remove a part of the person's lung and put their stomach in their thoracic cavity. That's no joke. So what do you do for people with GERD? Well, again, stop eating late at night, stop smoking, stop drinking, and usually don't eat about 3 or 4 hours before you go to bed, because you don't want that hydrochloric acid to increase its production right before you go to bed. Elevate the head of your bed. But then there's medications you can give, right? So typical medications are the antacids. Now, antacids do as their name implies. They neutralize the hydrochloric acid. So these antacids are bases. So milk of magnesia, rolates, Tums, Maalox. And those were the older generation. The newer generation now are designed to prevent those proton pumps from pumping the hydrogen ions into the stomach. So you have PPIs, proton pump inhibitors, Nexium, Prilosec, Prevacid, Protonics, right? Those are the newer generation. The relatively older generation of acid reducers deals with these receptors. If you remember where I put it, there it is. One of the things that can stimulate the production of hydrochloric acid is histamines. So you have these receptors in your parietal cells called H2 receptors. So you take H2 receptor blockers. Those are like Zantac, Acid. Those block histamine. But the drug of choice now are your proton pump inhibitors. You have Tagamet too, that's H2 receptor antagonist. And then for people who develop peptic ulcer disease, there's a drug called Carafate. Now, Carafate is one of the, you can't see that. Carafate is one of those drugs where it doesn't necessarily act on cells. It will actually coat the damaged, eroded area of your lining of your stomach. So that's one drug that actually kind of coats the problem. Doesn't get rid of it, just prevents further damage. So that's gastroesophageal reflux disease. Now, back in the day, they believed that one of the things you're born with, one of the innate immunity that you have, is the hydrochloric acid in your stomach. So if you hack up a loogie and you swallow it, let's say you have a respiratory infection, and you hack up some mucus and you swallow it, well, you would think, well, gee whiz, that bacteria is still in there. But the hydrochloric acid in your stomach will destroy that bacteria because they believe that most bacteria couldn't survive in an acidic environment. Well, they found one that could. It thrives in it. It's called H. pylori, Helicobacter pylori, and it thrives in a very acidic pH. And when that bacteria multiplies, it will release toxins that will erode and damage the lining of the stomach. So you get a condition called gastritis. So remember, anytime you're exposed to a pathogen in this case, then your B cells will get turned on, right? And they will produce antibodies. So one of the ways that you can test to see if somebody has been exposed to H. pylori is to test to see if they have the antibodies for it. And it's a blood test. And then if they do, and that can be the cause of their gastritis or GERD, then they're given what's called PrevPEC. And a PrevPEC, as the name implies, is the proton pump inhibitor, and it's usually a combination of two antibiotics. Flagyl, which is has antifungal and antibacterial properties, and usually Biaxin or I think it's amoxicillin. And you take that for about 2 weeks, and usually that is enough to destroy the H. pylori. And you should be relatively cured. Okay, I'm going to spend a few minutes now on peptic or gastric ulcers. Now remember that in most cases, the hydrochloric acid that's formed by parietal cells and the pepsin that's formed by the chief cells of your stomach usually shouldn't damage your stomach because of the protective mucus lining that you create. And that protective mucus lining, again, is rich in bicarbonate, right? Now, watch. One of the signals, one of the chemicals that signals the production of mucus from goblet cells is this chemical called prostaglandins. Prostaglandins are involved in inflammation, they are involved in pain, and they're also involved in the production of fever in the body. So if you have pain and inflammation, say you, I don't know, you dropped your textbook on your hand and it hurts. Anyways, when you take drugs like ibuprofen or aspirin, these medications inhibit the synthesis, the production of prostaglandins. But prostaglandins are chemical signals that will signal goblet cells to produce that protective mucus lining. So if you're chronically taking ibuprofen for a bad back or a bad shoulder, then the goblet cells are going to chronically be suppressed because you don't have prostaglandins to stimulate the production of mucus. So when you form hydrochloric acid in the stomach, right, when you form that HCl, you're not going to have that protective mucus lining. And you won't have that protective mucus lining to prevent pepsin from digesting protein. And again, the stomach is made out of muscle, protein. So without that protective mucus lining, the hydrochloric acid and the pepsin will begin to erode the stomach lining. And that leads to gastric or peptic ulcers. Now, look, the GI tract is vascular. So if you develop a ulcer and the erosion is enough where it starts getting into and eroding blood vessels, you are going to bleed into your GI tract. So you're going to develop red blood cells in your GI tract. And if you recall, right, red blood cells, they're made of fat, carbs, and protein. And it's got a big freaking protein in there called hemoglobin. And hemoglobin has embedded in the heme portion is iron. That's where you carry the oxygen. So your digestive tract doesn't know that you're bleeding. All it sees is carbs, fat, and protein. So your digestive system will begin to digest the red blood cells. And when you digest the red blood cells and the hemoglobin, you free up the iron. And if you're a woman and you've been pregnant and you take iron supplements during your pregnancy, you know that it turns your stool dark and tarry. So if you have a condition, right, where you have stomach pain, then all of a sudden your stool starts turning dark and tarry, then you know that that blood is going through digestion. And if that blood has gone through digestion, then that bleed is higher in the GI tract. The lower the bleed is, the less digestion is going to go through. So if you have bright red blood in your stool, then you know that that blood has not gone through any digestion and it's lower in the GI tract. So that's one of the questions that doctors and nurses will ask you. Have you noticed a change in the color or consistency of your stool? So, and one of the ways or areas that you can be bleeding is in the stomach. Well, how do you diagnose that? Well, it's based on signs and symptoms. People will complain that they've got heartburn all the time, right? Pain in the epigastric area. They may become fatigued due to the anemia if the bleeding is severe enough. Their stool has changed, become dark and tarry, and they may look pale because of the loss of blood. So what they usually do is they do an endoscopy. They put you out a little bit, stick a tube down there with a camera, and they can actually see if there are bleeding areas. If it is bleeding, they can cauterize the bleed, and basically what the rest of the time they do is they tell you to stop taking ibuprofen, drinking, smoking, swearing, and not reading the textbook, and they will give you proton pump inhibitors. And once you've gone off the ibuprofen, taking that routinely, then the protective mucus lining will come back. The other drug they give you is, again, carafate, and that kind of coats the inside of the stomach and prevents the hydrochloric acid and pepsin from making situations worse. So that's really peptic ulcer disease, and a lot of the medications used to treat peptic ulcer disease are similar to medications used to treat GERD. One more thing: if you work in an ICU, or even on a general medical surgical floor, right? Being sick or getting cut open is stressful. And when you're stressed, your sympathetic nervous system is stimulated, and that's going to cause the release of epinephrine. And there are beta receptors on parietal cells. And when epinephrine binds to beta receptors, it stimulates the proton pump and causes the formation of hydrochloric acid in your stomach. Now, if someone's had surgery and they're intubated, they just got cut open, that's stressful. But they can't eat because general anesthesia does just that. It generally anesthetizes all of your body. So until your bowels start moving again, you can't eat, because if you try to eat anything, you will just throw it up. But with the stress, that's stimulating the production of hydrochloric acid. And one of the things that stimulates mucus, to protect the mucus lining in your stomach, is the parasympathetic nervous system and the formation of that protective mucus lining. But if you ain't eating and you're stressed because you just got cut open, you are going to make that protective mucus, or you're not going to make that protective mucus lining, but you're going to form hydrochloric acid in your stomach. So this can lead to stress ulcers. That's why a person who's had surgery and you know they're going to be intubated for a while, you want to prevent the formation of stress ulcers, or ulcers induced post-surgical. So that's why they stick an NG tube down, and every couple hours you put some Maalox or Mylanta down that NG tube to neutralize that hydrochloric acid that's formed as a result of stress. Now, just one more thing. The most common place to develop ulcers is in the duodenum, duodenal ulcers. And the reason for that is the duodenum doesn't have that good protective mucus lining like the stomach does. So what are you doing when that food that has a very low pH, it's very acidic, leaves the stomach and goes into the duodenum? If you don't digest that food right away, and your pancreas ain't working so good, and I'll explain that later, that can lead to duodenal ulcers. And again, the treatment is basically the same way. All right, and one more thing. One of the things that's required in order to absorb vitamin B12, cyanocobalamin, is a chemical that protects vitamin B12 from being destroyed by your GI tract. It's called intrinsic factor. Intrinsic factor is found in the lining of the stomach and to some degree in the duodenum. Basically what it does is it coats and protects the vitamin B12 to allow it to be absorbed into the bloodstream before it's controlled or before it's destroyed. So any condition that is going to erode, damage the lining of the stomach is going to decrease the amount of intrinsic factor. As people age, the amount of intrinsic factor and their GI mucosa, the lining of their stomach, just naturally atrophies. So they develop a condition called pernicious anemia. And you can take all the vitamin B12 you want, but if you can't protect it because you don't have intrinsic factor, it's going to do you no good. So what these people have to do is get monthly injections of B12, cyanocobalamin. Without that, you get that pernicious anemia, and basically what it does, you need vitamin B12 to make nice, healthy, normal-sized red blood cells. Without it, you make big, fragile red blood cells, so when they go through the capillary, they rupture, and now you have a decreased number of red blood cells, which is anemia, hence the name pernicious anemia.